Hi, my name is Viraj. I'm 17 years old. I'm an 11th grader at Mission San Jose High School from Fremont. And it's my pleasure to introduce Picha Sogsini, a senior clinical research coordinator with the Celiac Disease Program at Stanford University. She works closely with Dr. Jericho on research studies that aim to improve the lives of children and families affected by celiac disease, both within and beyond clinical care. If you've received a call or email from us about participating in celiac research in recent years, chances are she was probably behind it. Today, she is here to talk about a research study that explores how patients manage the gluten-free diet in school settings. Please join me in welcoming Picha.
All right, everyone. Thank you so much. My name is Picha. I'm a senior clinical research coordinator here at the center. And today I'm here to present on creating celiac-friendly schools, enhancing environments for children's health. And so for anyone who doesn't know what a clinical research coordinator is, my role at the center is really behind the scenes, making sure our research studies are running. So I'm the one doing the paperwork, probably calling you sometimes, making sure the studies are actually functioning. So I'm here to share one of my favorite studies here at the center because I used to be a middle school teacher. So a study that involves going into schools and helping out our students and patients is really special to me. You're also going to hear I have teacher voice. So you're going to get really familiar with that for the next 14 minutes. All right, so before I tell you about the study, I wanted to go over a little bit of the background. So for our patients here and families who are familiar with celiac disease, it is a disease that's triggered by gluten ingestion, and the only effective treatment for celiac disease is to follow a strict lifelong gluten-free diet. However, that can be tough because gluten-free food is hard to come by. There is also very little research that explores the experiences that our students with celiac disease have in managing the gluten-free diet in school environments specifically, and very little research on how those school environments impact their ability to follow the gluten-free diet and their quality of life. Why do we care? Well, let's consider that with a question for you. So in teaching, I ask you to participate very quickly. And so what I want to know is, in your opinion, how much of a child's time do you think is spent in school? So if you think they spend 25% of their time in schools, give me a 1. If you think it's 50%, give me a 2. 75%, give me a 3. 100%, give me a 4. So let's see what we think. How much time do you think you spend in school or your students? Okay, I've got a lot of 2s and 3s. 2s and 3s. Okay. So the actual answer depends on what you're looking at. So if you think about the time you're asleep and the weekends too, it's probably 20% of your time in schools. But if you're just thinking about the weekdays, Monday through Friday, and when you're awake, it is 43% of your time awake during the school week that our students are spending in schools. And that's not even counting extracurriculars, which we're in the Bay Area. Our students are in a lot of extracurriculars. So we spend our students are spending so much time in schools, which is making it that much more important for us to make sure that our school environments can support our students in managing the gluten-free diet. This is why we care. So the study that I'm going to talk about has 2 major goals. One is to understand and describe the current impact that our school environments have on the gluten-free diet and our students' quality of life for students who are in kindergarten through 12th grade with celiac disease. The second goal of this study is to create educational resources for our parents, patients, families, and schools to get the finding from our surveys and improve the gluten-free diet adherence and quality of life in school settings. So we want to understand what's going on and use that information to create resources that we can use to make it better. With those goals in mind, there are 2 phases to this study. Phase 1 focuses on patient experiences. So we administered surveys to our patients with celiac disease, and we also invited them to participate in optional focus groups and semi-structured interviews. And really what we want to understand is, what is the patient experience? Do they feel supported with the gluten-free diet and managing it in schools? Do they feel like the schools are giving them good gluten-free options? And how are they feeling with their management? Right? I see a head shake. No, right? We feel very strongly about this. Phase 2 focuses on the school personnel perspective. And so similar structure, we have surveys and we've got focus groups and interviews. And what we want to understand is, do our school staff feel equipped to help manage the gluten-free diet? Do they feel, what resources are we even giving? We want to understand what's going on the other side too, because we can't support without knowing what the structure we're working with, right? So we're asking a lot of questions through these interviews and focus groups and surveys. The themes that we want to consider for all of this information are listed here. We want to understand student perception of access to gluten-free food at school. We want to understand what the students and the school staff think about the school provided resources. We want to understand if students feel confident in their school's ability to provide safe gluten-free meals. We want to know, are students satisfied with the gluten-free options that are in schools? We want to understand the behaviors in adhering to the gluten-free diet. Are we sticking to it? We also want to know, what are the school staff experiences in celiac specific dietary accommodations? School staff, I know it well, there's so many different accommodations to meet, and we want to know, are they helping, like what is their experience with celiac specific accommodations, right? So when we designed these surveys, we kept these themes in mind. And I'm not going to go through every single theme today, but I wanted to give you a few examples of the themes and the questions that were made to suit these themes. So for example, if we wanted to know about student perception of access to gluten-free food at school, in our surveys we asked, which of these meals does your school give you gluten-free food for? Or we asked, how would you rate the availability of your safe gluten-free options at school? For our theme, school staff experiences in the celiac specific dietary accommodations, we asked our school personnel, how confident are you in your ability to support students with gluten-free dietary needs? Or another question we put in was, how comfortable are you with identifying gluten-containing foods or gluten-containing art supplies? Another question, a series of questions we wanted to ask, was part of a celiac disease specific quality of life survey, otherwise called the CDUX. This is a validated survey. And so for those of you who don't know what a validated survey is, it is one that has been tested repeatedly and has proven to be a reliable measure. In this case, the CDUX survey is a reliable measure of quality of life. So this has been put in our patient surveys. It is 12 items, and each item is a statement. So for example, they see, when I have to explain to others what celiac disease is, I feel. Or when I think about food containing gluten, I feel. And then they answer with the emotion or face that they feel most represents how they feel when they read that statement. So that helps us measure their quality of life and how they're feeling with their experience with the celiac disease. So what are all these questions trying to tell us? What we want to understand is how all of these different factors that we're asking about might vary across school types. How does being in a public school affect these answers? How does being in a private school or a charter school affect the answers that we're getting? We want to understand the relationship between these factors and if those factors are affecting those quality of life scores that I mentioned on the last slide. We also want to know what the big differences are between student perception on access to these resources and the school reported outcomes. We want to see what the differences are between our students and our school personnel. So what did we find out? We're still collecting surveys right now, but at the 100 patient mark, we did an early analysis. Out of those 100 patients, 99 were included because one person had not started the gluten-free diet yet, so couldn't answer about their experience if they didn't have it. The middle age of those 99 participants was 12 years old. 54% were female identifying, 61.6% were white or European, and 77% attended a public school. We also can see, we looked at years that they were on the gluten-free diet. Most of them have been on the gluten-free diet for 1 or more years, so we're really getting answers from our gluten-free diet veterans. So out of those 99 participants, 87 went to schools that offered gluten-free or food options. From those 87, 49.4, almost half, did not adhere to the gluten-free diet. Yeah, right? So when you look at their quality of life scores for those 87 students at schools that provide food, you can see that the students who were non-adherent had lower quality of life scores compared to the students who were adherent to the gluten-free diet, okay? But we don't wanna just know if your school provides food, we wanna know if you actually feel safe with the food options that were given. So my second question to you is, in schools that provide food, how many of the students do you think that believe that their food is actually safely gluten-free? Okay, we already know what to do. Yes, so let me know what you think. One, yeah, get a lot of ones. Okay, all right. I didn't even have to give you directions for that one. So yeah, even lower, even lower. So out of those 87 students, only 2% of them felt like the safety of their gluten-free options was excellent. This is such a low number. And more than half, 62%, felt like their gluten-free options were non-existent or extremely poor. From these students, there was a large chunk in a public school. So 67 of these students were in public schools. That number is even larger. The non-existent category, even larger for those students. So I've just shown you a lot of numbers. What does it mean? Basically, most students with celiac disease who attend schools that provide food do not have safe gluten-free options, which I have a feeling we kind of already felt that, right, from the crowd. Almost half of them report no safe gluten-free options in our public schools. About half are considered non-adherent to the gluten-free diet. So they could be sharing food with others or intentionally or by mistake eating gluten-containing foods. And also students who do adhere to the gluten-free diet do report higher quality of life scores. To tie it all up in a bow, there's a lot of room for improvement for Bay Area schools to provide safe gluten-free food and support adherence to the gluten-free diet. So next steps that we're gonna take from here, because like I said, we're not done. We are still getting school staff and patients to do our surveys. We would like to get more school personnel. We're at 4 right now, so there's a big journey ahead of us there. We're also working on those focus groups and interviews. So we're working on elementary school student and school staff interviews at this time. From that, we want to analyze all of the data that we've gathered from our surveys and interviews. And from there, develop those educational resources that I mentioned of like 10 slides ago. And when we start making those educational resources, we plan on taking a very methodical approach. Phase one being to make foundational material, so basics like what is the gluten-free diet? How can you identify gluten-containing foods? How do we avoid cross-contamination? These foundational resources can go to families, community centers, schools, like they're very broad. Phase two is a comprehensive school guide targeted towards our school personnel. So how do you actually implement safe accommodations in the classroom? How can we meet national guidelines for safety? And phase three, pilot testing with diverse families and school personnel, because these resources are great, but if they're not actually usable, what are we doing, right? So we want to make sure that these are usable. We're revising and evaluating to make sure that our school personnel can actually use them. And with that, we're taking big steps. It's really important to be in safe schools for our students. And so I hope that this study gets us that much closer. Thank you.